Welcome to You Can't Handle the Truth with me, Natalie. I am here to dive deep into the truth about health, wellness, and self-growth. I am your real talk guru and your rebel healer, here to cut through the noise and dig deep into the mental, physical, and spiritual health, uncovering the truths that many aren't ready to confront. And we're doing that together to step into our authentic selves. All right. Today, we are just going to get right into this. I have a doozy here today about a rebel that went to her doctor, and wow, she couldn't even take care of her. Like, she just refused to hear her out. And how many times have we been to the doctor and heard this before? But let me just jump it right into it, and then we'll talk about what happened. Met a new doctor today. I told her I want to consider HRT, hormone replacement therapy, for my perimenopause symptoms. She's not a fan, and I appreciate that, but I was annoyed at how dismissive it felt. My anxiety gets very bad around my period, and I get night sweats. Not to mention oily skin, heavy and uncomfortable periods, etc., etc. Haven't we all been there? She said the thing about breast cancer. I said, it is an acceptable risk to me. No one in my extended family has had cancer and no breast cancer. She said, I already have anxiety, so if I am more anxious during my period, I should probably talk to my psychiatrist instead. It just rubbed me the wrong way. She said she'd write me a prescription if I wanted, but she doesn't think it's worth it. I asked her to go ahead and write it, and I will consider a little bit longer before filling it. And I'm not sure what SO stands for, is a doctor. We've talked about HRT. He's pulled articles to read and share with me. He found a podcast about women's health and aging and shared it with me. I feel like he's pretty solidly invested in my health and happiness. So if he thinks HRT is worth a try, I'd like to try it. I guess I'm less annoyed by her suck it up opinion than I am by her suck it up tone. If that makes sense. I'm used to doctors being more sympathetic. I saw this, ladies, and I talk a lot about getting second and third opinions. I just had to take a deep breath, because I have been there where my concerns have been ignored. And I wonder if any of you ladies have been ignored or have had similar experiences. Drop me a comment, because I'd love to hear it. She's annoyed by the tone. I guess she's concerned that she's annoyed about the tone and wondering whether or not she should be annoyed. Yes, she should be annoyed. We go to the doctor, we pay the doctors, and then we can't get them to listen to us. It's pretty sad. And at the end, we'll read some opinions that she received from other people. But I wanted to share this with you, because when I saw this, I also, in my mid-30s, had some symptoms, but when I went to the doctor, no one addressed it. And since, if you're like me, most families don't talk about perimenopause and menopause, so you have no idea what's going on with you. So when you start to have different symptoms, you just start going to the doctor with your symptoms, and you want the doctor to tell you. No one told me, and I didn't even realize that in my mid-30s that I might start to need hormone replacement therapy. At 47, I think I was, after I had been going to the gynecologist yearly and telling her that my periods had gotten heavier, and still there was no discussion of menopause, perimenopause. at 47. And by that time, like, the bleeding was so heavy, when I had my period, I couldn't even leave the house, because if I coughed, I would soak through everything. And so eventually I had an ablation. By the time, I think I was 47 when I had the ablation, and went on to continue having like mood swings, all the things she talked about, hot flashes, night sweats. It was ridiculous. I just avoided going out because I was embarrassed that if you have night flashes, you know that you can't control them. You don't know, some things trigger them and you can avoid that, but even avoiding the triggers like alcohol will not help, because it just comes on, and you could be sitting in a room filled with people and everyone's just chilled, relaxed, nice and comfortable, and you're sweating like you're in a sauna. And so that got to be embarrassing. And so finally I had a friend who recommended bioidentical hormone replacement therapy that she had been receiving, and she said it changed her life. And so about 5 months ago, I went. So this was interesting. When I saw this article, I was like, I have to share this with you ladies out there, because I am sure there's many of us out there who have been basically told to suck it up. We're hearing these things from some of our doctors that won't help us because of the clinical studies on hormone replacement therapy. I did some homework. I'm not a doctor and I can't tell you what to do, so you should follow and do what your doctor tells you. But I will suggest, I am a registered nurse, so I will suggest that anyone that's having an issue that goes to their doctor that cannot get their doctor to listen to them or work with them on something that they would like to try, to get a second or even a third opinion. That's always my advice to my patients, because I think it's unacceptable to go to a doctor and you're basically crying to them like, I can't take this anymore, and they don't want to do anything to help. Or they just, I don't know if I can't say that they don't want to do anything to help, but they don't do anything to help. And then they are very, very abrasive with their approach of how they tell you that that they don't want to help you. So anyway, I'm going to link an article to PubMed that I pulled from PubMed on this hormone replacement therapy for those of you that are concerned and are thinking about hormone replacement therapy. I did go to the doctor and found a male gynecologist and obstetrician who did work with me and give me the hormone replacement therapy, and I did that about 5 months ago, and I have to tell you, it changed my life. He said it would take 3 to 4 weeks to work, and within a week the sauna had stopped. It literally turned the sauna off, and other symptoms went away too. I want you all to know that you're not alone if you have experienced this, and I want you to know that you should get a second or third opinion. I literally went online and I Googled to find a doctor in my area who was offering bioidentical hormone replacement, and I went with that option as opposed to the synthetic hormone replacement, just because I felt like it was more identical. The bioidentical would be closer to me. And I think studies are showing that studies are conflicted actually on the topic of, are you going to get breast cancer from hormone replacement therapy? There's a lot of conflicted studies out there, but there was a study that showed that I think it's about 1% of women get breast cancer that take this hormone replacement. And then they did another study, and it went up to 2% or something like that. And then it was blown out of proportion on the media, and they said, oh, the risk doubled from 1% to 2% chance out of 100%. But meanwhile, you have symptoms. And here's the other thing about decreasing hormone levels. When your hormone levels are switching, do you know that as women, we are more at risk for heart disease? She had a female physician. I've had female physicians before. My current, especially at OBGYN, who will also go through some of the same things that we go through, that they would be more empathetic. But no, I eventually found a male physician that was most empathetic to my situation. And it's just the irony of it. I'm not saying that all female OBGYNs are not empathetic, but I'm just saying it's the irony of that she would have a female physician that would just put her off. And I understand the concern about breast cancer, but then you work with your patient. You work with your doctor. Because I've been there when I couldn't leave the house. I've been there when my blood count was dropping because it was like a bloodbath. Let's take a look. Let's take a look. I want to look at some of the comments. Somebody wrote to her, the breast cancer study has been debunked. Your doctor is way out of date. Your SO should know that too, if he is a doctor. Someone else wrote, it makes me so mad that they made such a big deal about it a few years ago. Didn't the study say it increased the chance of breast cancer from about 1 to 2% or some low number? But then the news said it doubled a woman's chance. If one doctor doesn't listen to your health concerns, then change doctors till you find one who listens. Let me see. Also, the risk of heart disease and newer links to perimenopause and the development of Alzheimer's associated with hormonal changes that can be helped by HRT. So, yeah, there's studies that show that the hormone replacement therapy can decrease the chance of us having heart disease as we get older, because that's a risk, and also Alzheimer's because of the hormonal changes. Women have a higher risk from heart disease than breast cancer. I take regular mammograms and medication that can support heart and brain health over a tiny increased risk of breast cancer. That was someone else's opinion. Before anyone jumps all over me about that, because yes, it can end you, but statistically, the others are worse for the average woman. And listen, ladies, this is a personal decision. But what really irked me was that this is someone who said, I'm willing to take the risk, and her doctor just dismissed her. Not acceptable. That's just not acceptable. I'm trying to see. Someone asked about starting HRT years after menopause. That's something you have to check with your general practitioner. Obviously, if I started I was in perimenopause, I'm not full blown yet, although I need to have a test. But I lost my train of thought, ladies. This was so frustrating to me and it's not only for this reason. If you have anything that you're going to the doctor for and you feel like your doctor is not addressing your concerns, or they're not empathetic to your concerns, then you know what? It's time to get another opinion. It's definitely time to get another opinion. Someone says, if I remember correctly, the number was 25% increase in breast cancer, but the sample size was small, and the 25% meant it went from 4 people in the control group to 5 people in the HRT group. From 4 people in the control group to 5 people in the HRT group. See, that's the other thing, because if the statistics were reported right, it wouldn't have been a statistically significant increase. So you have to understand about statistics also, because if the group is small, the control group is small, and the whole group that they're testing is small, how are you testing that over the whole population and coming up with this number? Your number is only going to be significant to the number of people that you had. So you need a significant number of people to actively represent the perimenopausal and the perimenopausal group, at least in the US. It's all over the world, right? But at least let's do a control group that represents the US. And okay, my sister-in-law got this from a gynecologist who told her there's no way she'd prescribe HRT. Now, no one would. And the doc was following FACOG. It took me 3 minutes to find papers and videos to refute that, from urology to GYN to family practice. I know it's impossible to keep up with every darn thing, but come on, medical peeps. Yeah, they're not. Oh, this is the comment I was looking for. There was a comment here I wanted to share with you. Let me see if I can. It says, someone here says, please read Estrogen Matters. It will help you make decisions about using HRT, types, doses, when to start, if you should, and give you information about why certain studies are not reliable. So there's an article there's something called Estrogen Matters. I'm sure you can look it up online. And I hadn't looked it up yet, but let's look it up together, because I want to make sure that I'm giving you correct information here, because I think we all need to be looking this up, because it's a shame that we're not getting the correct information that we need. Okay, so Estrogen Matters it's a book, and you can get it on Amazon. Estrogen Matters: Why Taking Hormones in Menopause can improve length of women's lives without raising the risk for breast cancer. So this book is about $27 on Amazon. So if you're considering and you want to make a informed decision, this might be a good book for you to read. We need the resources because we need to be making informed decisions, not just going to the doctor and then the doctor says, oh, no, I don't think so. Because what I'm finding also, ladies, is that you have to advocate for yourself, and no one other than you actually cares whether you get better or not. This has happened, someone writes, this has happened to me to varying degrees so many times. It shouldn't be this way. And it's even worse for people who aren't educated or don't feel comfortable advocating for themselves. They get even worse treatment. Here's someone who says, I had a doctor who was very warm, but in 3 or 4 years I saw him, he never could find the time to learn about my chronic conditions or find any insight into how to treat me. I stayed for the warmth because I've had some really invalidating and harmful experiences with doctors. So I know how much worse it can be. Isn't that a shame that you'll stay with a doctor that's not giving you the care because you know how much worse it can be out there? When he left for a private practice earlier this year that doesn't take insurance, I found out that his caseload was over 1,500 patients. No wonder he never had the time or space to research my health conditions. He honestly always seemed run ragged, so I guess that was why. This wasn't an overwhelmed community clinic either. It was an office in a well-off county. I think this is how most doctors' offices are run these days. The doctors are so overwhelmed by their caseload that they aren't able to actually practice medicine beyond running annual blood tests. They don't have the time to truly keep up on new research and shifts in understanding in the medical world. As someone with 2 chronic conditions, it's scary and frustrating. So I'm going to stop there with the comments because, ladies, I want you to advocate for yourself. If you have doctors running around with 1,500 patients on their caseload that they're seeing a month or however long they're seeing them, do you think they have time to research everything that goes with you? This is not the first time I have heard that. And these practices are run by the health management organizations. And being run by the health management organizations, they even dictate how much time they can spend with you. So do you think after a doctor spends 15-minute visit, of which you probably see him for 5, or see her for 5 minutes or whatever that time is that they're allotted to see you, and they've seen, I don't know, 50 patients in that day, that they have time to go home and do research on your conditions? We have to advocate for ourselves, and we have to find doctors that will listen to us. And I know it's hard. Do your research and don't be discouraged. And as someone who is currently receiving bioidentical hormone replacement, I shared a little bit of my story with you and how my symptoms have improved. You can email me if you have any questions about, how I'm doing, and you want more information. I shared a little bit, but if you want more information, if you have more questions, you can email me at naturalshop@gmail.com, and I will put that email address also in the description box, because I want all of us out there to be informed. We are so misinformed going into perimenopause, which can start as early as mid-30s. And then it's not addressed until the symptoms get severe. That's when we start to address it. And then at that point, we can't even get the treatment that we need, or the doctors won't advocate for us to get the treatment that we need because maybe they just don't have time to do the research that's needed so that they can treat us properly. Anyhow, that's all I have to say about that today. Thank you for joining me on You Can't Handle the Truth. And until next time, you stay beautiful, you stay strong, you stay inspired, and you stay what? You stay sexy, so you can keep taking care of yourself and those around you, and keep advocating for yourselves. Drop me a comment and let me know what you think about this. Peace and love.